families are forced to find new health insurance, and female students gather together for a cause and a haircut. All this and more today on Uptown.
For Joseph Schroyer, a graduate assistant and full-time student at UC, things have had to be altered in his life now that dependent coverage has changed.
I needed to get an outside job. And really that is a taxing situation for myself, not only like amount of hours that I can spend here at UC, the amount of hours I can spend doing my work, my homework, the amount of hours that I can spend supporting my classroom activities, so on and so forth. But that also means taking away time from my wife and my child. So my wife works part-time as well. There was no way that she could necessarily do full-time because we didn't want our child going to somebody else's care.
Joseph currently is working at a hospital to get health care coverage. He feels that the options Health Services has proposed in terms of Medicaid and insurance online are not good enough.
I've explored the option that Mr. Andrews gave us as far as ehealthinsurance.com. They don't even cover maternity on these things. So if my wife and I would like to have another child coming up, it wouldn't be covered.
John Andrews at Health Services feels this plan was implemented with the student's best interests in mind. After all, a student committee along with GSGA voted this change in. The change has also subtracted $36 off the quarterly price.
There's a student health insurance committee, and they meet several times during the year. Students come in and discuss what things they want to have in the policy, what benefit changes, and then the insurance company gives the committee a price for the changes, and then the students look and figure out which ones they want and which ones they don't want. And we asked for renewals as to what it would cost if dependents were no longer covered, and the insurance company came back and said it would be $36 per student per term savings if the university did not insure dependents. The other piece that added into that is we were only selling in the low 40s policy for the whole year, so that's only like about 14 policies every term. So it was not a popular option, insuring dependents. And I think it was really that the insurance company rates were not that good for dependents.
Nick Miller, a current eMedia student, is also in a tough situation. Having had health care from UC before, he will now have to look elsewhere. He's uncertain about the change and what it will bring to his family.
I just recently found out that I'm going to be a father of a little girl, and I previously had health insurance through my father, but after I turned a certain age, I got kicked off of that. So now I'm struggling on my own, even though I'm still living at home. I have 2 part-time jobs, and unfortunately am unable to get health insurance through them. I just wish that there was, some form of, somebody looking out for me, some form of some help out there that makes things not as hard. But will I pursue a health insurance policy? Probably not with UC.
Healthcare policy and coverage has changed at the University of Cincinnati. Our student committee and healthcare services feel this change is for the best. It will benefit our community both financially and still provide stable coverage for everyone at the University of Cincinnati.